Good afternoon and welcome to Washington National Cathedral. My name is Randy Hollerith and I am the Dean of the Cathedral. And on behalf of Bishop Mary Ann Budde and all of us who serve this wonderful institution, it's our pleasure to have you here with us for this special event. This cathedral is a house of prayer for all people, and I am honored to stand this afternoon with many of our brothers and sisters from a variety of different faith traditions. Our various traditions, as unique and special as they are, have numerous things in common, and none more so than what is commonly called the Golden Rule. Whether it's expressed as do unto others as you would have others do unto you, or that which you want for yourself, seek for mankind, or love your neighbor as yourself. This ethic of mutual regard and reciprocity is fundamental to the vast majority of faith traditions. As such, what could be more appropriate than for us to gather today and encourage all people, especially people of faith, to make sure that they get vaccinated, not only to protect themselves from COVID-19, but more importantly, to help protect others from this terrible disease by increasing the levels of immunity within the population and by helping to slow the mutations of this virus that have caused so many even more infectious variants. As people of faith who are called to love and care for our neighbors, we should be leading the way in this effort. And so we stand together, or sit together, as the point may be, to send a clear message that these vaccines are a great blessing. They are a great blessing. And we need to take advantage of that blessing. And we need to encourage others to do the same. So thank you for being with us. And in a few minutes, we'll have some brief remarks from some special guests that I would like to thank for being here and introduce to you. The first is Melissa Rogers, who is the Executive Director of the White House Office of Faith-Based and Neighborhood Partnerships. So glad she's with us. Dr. Ileso Perez Estable, who's Director of NIH's National Institute on Minority Health and Health Disparities. Dr. Francis Collins, the Director of NIH. And the man who needs no introduction, Dr. Anthony Fauci, the Director of the National Institute of Allergy and Infectious Disease. I want to thank our special guests for being with us. Thank you so much. Again, we're so thrilled that you're here with us, and thanks to all the jurisdictions who have come and to support this event and to give vaccines. It seems to me to be an incredible blessing from God that we were able to get all of this together, so thank you. Now I'll turn this over to the man who not only thought of today's event, but whose very hard work made it possible, the Reverend Dr. Leonard Hamlin, who is our cathedral's canon missioner. Leonard.
Thank you. Over the past year, words such as community, spirit, compassion, justice, and a host of other words have been elevated in our vocabularies. The words are significant, but they have power only when they're connected to our actions. This evening, we have gathered in this space recognizing the challenge of this moment, but we've come together embracing the opportunities that are in front of us. It is important that we encourage everyone who is able to get vaccinated. Faith leaders, medical chiefs, managers, regional officials are all here that we might not be defined by the demographics that often divide us, but we are here embracing the truth that unites us. A truth that is probably characterized best in words that I've always heard growing up, that because of our faith, the task ahead of us is not as great as the power that is behind us. And so I remind us on today of the words of Robert Frost that said, "Two roads diverged in a wood, and I took the one less traveled by, and that has made the difference." Today, we have come together that we might make a difference in the moment in which lives are at stake. And we recognize today that everyone needs to be counted. And so the words of one who was lifted here years ago that we all know well, it is true, as Martin Luther King Jr. said, in a real sense, all life is interrelated. All men are caught in an inescapable network of mutuality, tied in a single garment of destiny. What affects one directly affects all indirectly. We are all in this together. And so I'm thankful today to recognize the faces that are on the platform that are representing the medical community, faith community, as well as even the educational community. And on this day, I'd like to recognize and say thank you to County Executive Mark Elrich, the County Executive of Montgomery County, Maryland. I'd like to say thank you to Dr. George Askew, Deputy Chief Administration Officer for Health and Human Services Education, Prince George's County, Maryland. Dr. Joseph Wright, who is Vice President and Chief Medical Officer of the University of Maryland Capital Health Region. Dr. Ankur Shah, Principal, Senior Deputy Director, District of Columbia, Department of Health. I'd like to give a special thanks to the Reverend Thomas Bowen, the Mayor's Office of Religious Affairs of the District of Columbia, who did a lot of heavy lifting with me in this moment and reaching around to help the cathedral to live its mission, the Washington National Cathedral. I'd like to say thank you to Dr. Ruben Varkes, Public Health Director of Arlington County, Virginia, Councilman John Taylor Chapman of Alexandria City Council, Dr. Hugh Mighty, Dean of Howard University College of Medicine and Vice President of Clinical Affairs, Dr. Shelley McDonald Pinkett, who is the Interim Chair of Internal Medicine and Chief Medical Officer of Howard University Hospital, Dr. Michael Crawford, Associate Dean of Strategy, Outreach, and Innovation of Howard University. You've heard many names as well as different communities represented, but today we come as one because the only way to achieve success in this moment is by our reaching across and working together. There is an old African proverb that says, if you want to go fast, go alone. But if you want to go far, go together. Today, we go together.
Good evening, everyone. I'd like to thank National Cathedral for organizing this terrific event tonight and for inviting us to participate. This is one great example of a partnership between government and faith-based organizations. And as President Biden has recognized, faith-based organizations can play key roles in helping Americans get vaccinated. Let me mention just a few reasons government should work with interested religious leaders and faith-based organizations on vaccination efforts. First, houses of worship are pervasive and familiar to many Americans. Countless Americans are far more comfortable getting their shot in a house of worship than in a pharmacy or a doctor's office. Second, religious figures are among the most trusted community leaders. So seeing congregational leaders get vaccinated first can relieve anxieties and fears. The third reason why government and faith-based organizations should work together in this task is that faith-based organizations are often highly skilled at reaching underserved people. Indeed, congregational leaders haven't simply turned over their buildings for use as vaccination sites, they're also manning the phones to get people vaccinated. They're providing transportation to vaccination sites and doing so many other things to make this task one that is doable for everyone. Fourth, the vast majority of religious leaders are enthusiastic about helping the country get vaccinated. Many clergy have emphasized, for example, that getting the vaccine is a way of loving our neighbors. Fifth, governmental partnerships with faith leaders to promote public health are permitted, not prohibited by our Constitution. Indeed, partnerships with diverse faith communities can be a powerful affirmation of our pluralism and our unity across our differences in background and belief. So in sum, governmental partnerships with faith-based organizations can and should be part of the solution to the COVID-19 challenge. As President Biden has so often said, there's nothing that Americans can't do when we do it together. Thank you.
Good afternoon. I'm Francis Collins, the director of the National Institutes of Health, which we sometimes like to call the National Institutes of Hope. And I'm certainly here in a hopeful way today, looking up at that stained glass window in the twilight, reminded that I have a copy of that hanging in my window in my home office, where I've essentially been a hermit for the last 12 months, trying to manage the largest supporter of biomedical research in the world. And I'm honored to be in this sacred space again with these leaders of multiple faiths. Let us all recognize that the last year has been one of struggle and of lament for all of us. And yet we now have reasons for hope. As a believer and a scientist, I can see the opportunity to use the tools of science as a chance to be part of God's plan for healing. The vaccines have in many ways for many people been an answer to prayer. They are safe and effective beyond what we had a right to expect. And yet, they will not help people by sitting on the shelf. They need to be injected into the arms of those who need them. Unfortunately, many who could most benefit because they are at highest risk of serious and even life-threatening infections are still holding back, worried about stories they hear, skeptical, unimpressed by how government has previously shown interest in their medical care. Skeptical. The church can play a leading role by educating, modeling, and encouraging that there is nothing to fear here and there's much to be gained. That's what we are here to do today. Houses of worship are houses of hope. Here on this hill, the National Cathedral represents that. And yes, we all need hope at this time. But hope alone is not a strategy. Today, all of you are putting hope into action. Hope for an end to the terrible suffering and loss of life from COVID-19. Hope for an end to the economic devastation it has caused. Hope that the vaccine can not only protect you, but also, if we do this together, your family, your friends, your community, your nation, your whole world. This is a love your neighbor opportunity to spread that hope far and wide. The Jewish tradition has a metaphor about community, that community is like a ship. But if there's a hole in the lower hold of the ship, one does not say, only the lower hold has a hole in it. Rather, all must recognize the risk of sinking. So everyone works to repair that breach. In order for us to get through this challenge of COVID-19, we must work together to repair any breaches that might allow that virus to continue its terrible tragedy around us. And that means all of us working together. So my deepest thanks to all who have gathered here, all who are listening, the other remarkable people on the platform, for joining in this plan to repair any breaches in our ship of vaccine healing. Thank you very much.
Good evening. My name is Tony Fauci, and I'm the director of the National Institutes of Allergy and Infectious Diseases at the National Institutes of Health. I first want to underscore all the important points that were made by my colleague and friend, Dr. Francis Collins. But I also like to spend my couple of minutes talking to you a little bit about the facts and some of the fiction associated with vaccines. How do these vaccines work? I often get asked that question by people who understandably want to learn more about what it is that's being injected into their arm. Vaccines that we have for COVID-19 all have one thing in common. It takes a single protein of the virus, not the whole virus, and that protein gets expressed in different ways depending upon what particular vaccine platform that is being used in the vaccine that you will have. Some have a little snippet of messenger RNA that codes for the protein, the spike protein on the virus. Others are little harmless viruses that have the DNA for that spike protein, that when you inject it in, it makes the protein. The body thinks that it's the virus, but it's not the virus. It's a harmless protein component of the virus. So that when the body sees that, it thinks it's the virus, and it makes a very powerful immune response to protect you for when you do get exposed to the virus. So how do we know these vaccines work? We know they work because they've been tested in tens of thousands of individuals. 30,000 people in the Moderna trial, 44,000 people in the Pfizer trial, and 40,000 people in the Johnson & Johnson or J&J trial. And there's more to come because there are also more vaccine candidates that we're evaluating. A common question that we get asked is, how can you be sure that it's actually safe and effective? And the answer is because they've been tested in tens of thousands of people, and the decision about whether it works, namely is safe and effective, is not made by the administration, not made by the Congress, not made by the pharmaceutical company. It's made by an independent group of scientists, ethicists, statisticians who look at the data and in an independent manner decide whether it is safe and effective. Then that data goes to the FDA, whose career scientists look at it and in association with their own advisory committee make a decision whether or not it should be administered to all of us, myself included. So the answer is that the process is both independent and transparent. Another important question is, but you've been telling us that it takes years to make a vaccine. How could you possibly have a vaccine when you just knew the virus was a new virus in January of 2020, and 11 months later, you're injecting a vaccine into our arms? And the reason is the extraordinary scientific advances that have taken place decades before January 2020. In other words, things didn't start on January 10th, 2020. They started decades before by large numbers of scientists who were working their way to the point where we could actually have this vaccine. Let me close by making a couple of comments about some of the myths about this particular vaccine, that we can understand how people can have these kinds of false rumors, but let's address them. We often get asked, can you get COVID-19 from the vaccine? As I just told you, the vaccine is a small component of the virus. It's not the virus itself. So it is impossible to get COVID-19 from the vaccine. Secondly, does it get into my DNA? It is biologically impossible for that to happen. Can it make me sterile? There is no biological reason at all to think that that would happen, and already tens of thousands of people have received the vaccine with no significant adverse events. And then the one that's particularly interesting to me is that no, neither I, and I believe I can speak for Bill Gates, have put a chip into the virus when it gets injected in you. That might seem ludicrous, but there really are things as ridiculous as that are being circulated. So I want you all to realize that this particular process is very well controlled with the highest standard of ethics. So I want to close by thanking all of the people who've been vaccinated, as well as those who plan to get vaccinated, because what you're doing is not only protecting yourselves, your families, and your communities, but you're being part of the important process of ending this terrible pandemic that has essentially immobilized our country and the world for the last year. We will get through this, and we will get through it by vaccination. Thank you.
Good afternoon. My name is Eliseo Perez Estable. I'm the director of the National Institute on Minority Health and Health Disparities, and it is a real honor to be here to talk to you today for a couple of minutes. I recently read that the Washington Cathedral was the place where Dr. Martin Luther King Jr. gave his last Sunday sermon just a few days before he was assassinated in Memphis. So I thought that was fitting for us to be here today, working to support and encourage all of our communities of color, to do what we can do to be safe and help end this pandemic that has devastated so many families in this country and in the globe. Today, disparities have been shown by COVID-19. This pandemic has illustrated inequities in our society that we knew about for decades, but really have been really put in contrast in a rapid way. In just a year, over 500,000 Americans have died. Over 50% of all cases and almost half of all deaths are in persons of African American, Latino or Hispanic background, American Indian, and Pacific Islanders. Now, much has been said about, well, the risk is greater because there's more disease, more diabetes, more obesity, more heart disease. But the reality is that the infections are more likely because people live in more crowded conditions. They work in jobs that do not allow the privilege of teleworking. They cannot self-isolate at home because the two families, 3 generations, 1 bathroom, these are just structural realities of the population. In addition, many do not have computers, depend on their cell phone for access to information, and therefore reaching this population has become more of a challenge. So this risk of economic inequality, educational inequality, and occupational differences is what leads to these disparities. Now, at NIH, NIMHD, and other institutes at NIH, our response has been that we need to address this by connecting with our communities. We have established a program called Community Engaged Against COVID-19 Alliance, or SEAL for short, with my colleague, Dr. Gary Gibbons, who could not be here today, from the National Heart and Lung and Blood Institute. Now, Dr. Fauci laid out all this misinformation that's circulating out there, and there is not a, it is everywhere. All communities are exposed to this. Our response is we need to address this misinformation directly with facts, with simple facts, not jargon, based on data, based on science, and to promote trust in science. We have lost this. We have not been ahead of this misinformation, and it's time that we started to do more of that, both in terms of the infection of how it's transmitted, but also on the vaccine issue once it is out, and we have certainly focused on that. This trust needs to be delivered by trusted messengers, and you, as faith-based leaders of all denominations, are really critical in this effort, much like local physicians, nurses, other healthcare workers, and other trusted leaders in our communities. We have a lot of faith that our SEAL initiative will make a difference in the states that we have launched it, and we continue to work on expanding it and turn towards vaccine uptake. So really creating the structures to promote, make it easy for people to get vaccinated, such as an event like this and other houses of worship opening up to being vaccinated. Now, I want to just close by saying that I'm confident that this effort is going to make a difference. I think all of us are eager to be able to again see our loved ones and share with people in person, not Zoom. I was vaccinated myself a little over 2 weeks ago, got my second shot. I went through the DC Vaccinate website. It wasn't easy, but I got it done. And I think the easier we can make it as we get more and more people vaccinated, the better it will be. Thanks everyone for being here, for organizing this. It really is important for all of us to be together to work towards a better future. Thank you.
Hello, I'm Mary Ann Buddy, Bishop of the Episcopal Diocese of Washington. After hearing such important remarks from our scientific, medical, and governmental communities, and in the presence of such esteemed colleagues in faith, I'm honored to close this portion of our gathering in prayer. May we begin by simply calling to mind all those we've lost. And those who suffer. And we thank you, gracious God, for all who have worked so tirelessly to bring the scourge of COVID-19 in this land and around the world to an end. We lament the inequities and the injustices that have caused so many to suffer needlessly. And we pray that this effort, along with others, will help overcome some of the disparities that have divided us. Let this vaccination effort be our marking event to create justice in our society and our healthcare system, and to restore the trust that is so needed for us to move forward. Most of all, gracious one, may those who have dared to go first be followed by those who go second, and followed by those who go third, fourth, and fifth, so that we might, by our example of following courage, might encourage others to be brave and do the thing that scares us, but also allows us to be part of this great journey toward restored life. All this we ask in the gracious name of God. Amen.
Thank you all very much.
We're going to move now, row by row, just off. We're going to follow Dean Hollerith off the platform, row by row. And then give the cameras a time to adjust, and then we'll walk through the table.